Hello, everybody. This is Jay Del Vecchio doing on the East Coast a little bit of an early evening at 6:30 with West Coast, giving you guys a different view there with Letty being out on the West Coast. We're doing 3:30 your time. This is exciting. Letty has a great topic here. Been teaching with us for, I don't know, 15 years and leading the way with a lot of fun subjects as an exercise physiologist, certified trainer, all that fun stuff. I'm going to cut right to it and let her get started. I do want to remind everybody real quick, though, that your quiz will follow along with the recording of this within 6 hours after the event. The quiz needs to be turned in by Monday by 5 p.m. to get credit for it, with you getting 80 percentile or better for the continuing education credit, which of course is free. That goes with being part of an alumni. This is exciting. So Letty, you go have some fun.
Thank you so much, Jay. I appreciate that. Welcome, everybody. I'm super excited to be here with you. And just a little bit about myself. My name is Letty Fritzsche, and I am a personal trainer, exercise physiologist. I teach over in San Diego University, doing the personal trainer course this summer again. And I'm really glad I'm here. I'm also a U.S. Navy veteran. I was a broadcast journalist, mass communications specialist for almost 12 years. And I was a performance coach for Velocity Sports Performance, correcting the biomechanics of every sport from youth to professional. PE teacher, I can go on and on, health and wellness educator. But with that, I'm going to go ahead and get started with the webinar. Please feel free to put some, messages in the chat, and I'll answer your questions as they come in. And so I'll go ahead and get started. So we're going to go ahead and cover today. We're going to recognize some common muscular back injuries, just really due to poor body mechanics, improper movement. We're also going to talk about ways that we can improve muscle strength so that we could help to reduce that risk of injury. We are also going to add some flexibility movements to help injury prevention. So we'll go ahead and get started. Oops, let's go on to the next slide here. Okay, so I just wanted to get started first. What are some causes of upper back pain? I'm sure we have all experienced a few or more of some of these back pain issues, but think about yourself. What are some things that you do on a regular basis that maybe might be contributing to back pain, whether it's the upper body, the lower, the upper back, and the lower back? And what are some things that you could do to help minimize that risk of injury? And just by tweaking some of the movements to help improve that. So I know for me, I tend to sit quite a bit and find myself slouching a little bit. So I always try to correct myself. Like now, I'm just trying to sit up. But we're always on our phone. So these are some of the things that actually can directly affect our back, upper and lower. So these, even though we're going to be talking about some strength training and some of the common errors and corrections, consider some of these things that we do on a daily basis as well. Like lifting improperly. I know I carry a backpack everywhere I go, so I tend to carry it on one side, but I should be putting it on both sides, but not overloading it, so much that it's going to cause problems. So just be mindful of some of those things that you do on a regular basis and what you can do to improve on that. So we'll talk about some of that in a little while. Okay, so let's go ahead and move on to the second. Let's see.
We've got an early question for you.
Oh, go ahead.
What kind of equipment did you have in the Navy, assuming you were on ships mostly? This is from Brittany.
Well, actually, I was on shore for most of my career. However, I was a Navy reservist, so it was 1 week in a month, and once a year I went about 2 or 3 weeks, and I did go to different parts of the country. But as far as being on shore, we did have a gym, and mainly I was using the free weights because I loved isolating those different muscle groups, especially the back. There were machines. The one thing about machines, though, is that they're great for people just starting out. They're learning the movements, but really not. I'm not too crazy about them because, especially when you're trying to isolate, because they're not altogether ergonomically designed for every person. So for me, I'm kind of short, so I do have some problems with it, but I tend to stick with body weight and using different implements. Uh, I hope that answered your question.
Sounds good.
Yes, thank you for that. Okay, so let's talk about the muscles that do make up the back. We do have the major muscle groups, and we also have muscles that are stabilizer muscles that help to get you through those different movements. Those stabilizer muscles are so important because it allows you to get through that movement with efficiency. Anyway, so we're going to look at the trapezius, which is the upper back. Also, the rear deltoid. As you know, the deltoids are made up of 3 different muscles: the rear or the posterior deltoid, the medial, and the anterior deltoid. But today we're just going to focus on the posterior, the back rear deltoid. We also have the latissimus dorsi, which is the lower part of the back, even though it kind of starts out all the way up under the armpit and fans out towards the lower back. We also have the rhomboid, which is a stabilizer muscle, the erector spinae, and the infraspinatus. So we also have the teres major and teres minor. So we're going to go ahead and focus on those major muscle groups and the stabilizer muscles. So we've got the superficial, the muscles that are more on the surface, the intermediate, they're a little bit more internal, and then the intrinsic, which is a deeper muscle. So let's go ahead and move on to the next one. All right, so functions of the back. So although we're focusing on the back muscles, you also need to consider that the shoulder muscles, like I said, the rear deltoids really play a factor in movement. So a lot of things that we do on a regular basis are things like carrying. Was there a question? I heard someone. Carrying objects, reaching for things, twisting, turning, lifting, and bending. So these, of course, are always are involving the shoulder muscles as well as the back muscles. So we'll probably be talking a little bit about those shoulders as well, because we do these things on a regular basis, not just with strength training. So we want to make sure that we're thinking about strength training and activities of daily living as well. So some muscular imbalances, like I said, once again, you're going to see, I'm sure you've been in the gym looking at, people doing these different movements and noticing, oh, wow, that must hurt, going into certain positions. So we're going to talk about strength training. Also work, like I said, I'm pretty much sitting in a chair or I'm standing and teaching. So even if you're just standing, that could also play a role in having, that back pain from standing for so long. But then consider those things that you do on a regular basis at work. And we're going to talk about some of the things that we can do to improve that. Also sports, I see it all of the time. Especially, I'm a teacher at my daughter's school. They're not there anymore, but I see in the gym, some kids that are doing high school, usually high school kids that are in sports, or middle school that, they're doing their squats wrong, they're doing their bench presses wrong, and I just cringe watching them. A lot of times it's the coaches that are in there with them, making sure they're blasting out those repetitions. So we'll talk about those imbalances that happen all of the time. And I see it later down in life where they're having all of these problems with their backs. Once again, we're just focusing on the back. But this also affects the activities of daily living. I've got my daughter who's only 20 and she's complaining of having back issues, because she played soccer, volleyball, basketball, all of these different sports. And so I don't feel that when she was doing her strength training, I'm not always there with her, but with her own coaches, that she may not have had, been working out the muscles of the back and the opposing muscles so that there's balance. So we'll go into that as well. And of course, following injuries. So if there are injuries, what are you doing to help protect those areas? You want to make sure that you incorporate not only, go through if there's any type of rehabilitation, but physical therapy. You want to complete that, and then beyond that. So what are you doing to helping to protect those areas? Are there any questions so far, Jay?
I don't see any. And again, anybody has something right away they want to point out, you are able to unmute yourself and then
Okay.
ask the question and engage with Letty. But right now, nope, we're
Okay.
good.
Feel free. Okay, so we're going to talk about overreaching. So there is functional overreaching, there's non-functional. So functional overreaching is, let's say that you're strength training and you might be in the gym just really gung-ho about getting those repetitions in and just using some high volume exercises, using heavy weight, and maybe you're kind of overdoing it. So instead of focusing on doing maybe 4, maybe 5 times a week, you might be going like maybe 5 to 7 days a week on those same muscle groups. So you might be kind of overdoing it. So just be mindful of that because you can overdo it and you're not giving your muscles, your back muscles, enough time to recover, to allow it to not only heal but correct and build. So it's super important that you get that proper time off, not only in between those exercise bouts for your back, but also in between those sets as well. You want to give it recovery time. So it's just kind of like a short-term effect. You might feel pretty sore, and but within a few days you might recover from that. But you realize that you overdid it. So there's a difference between just having general soreness. You're going to have those micro tears, which are normal, and healing and building. But you don't want to do it so much that you're actually maybe starting to feel some pain, so you might be doing those exercises, those repetitions to fatigue, but beyond that, where it doesn't feel so good, so just be careful with that. Non-functional is just, activities of daily living where you're, just maybe just overreaching, maybe like when I was, when I had kids in the car when they were really little, I was driving and I had to reach out and grab one of the kids, I don't want to overdo it. I might impinge something, I might pull something, so you want to make sure that you are working those opposing muscles for the back so that it's strong, but you also want to make sure that you work out that core as well. We'll go into that in just a little bit. So you want to just not overdo it, okay? So the overreaching can lead to fatigue, and that's not something that you want to be feeling. So like once again, you don't want to overdo it. So you're going to get that muscle soreness, that's normal, but overreaching, that's just a little beyond the regular soreness. So just look out for that. And then of course, like I said before, it could delay your recovery. So not a good thing to be overdoing it. Alrighty. So if you have any questions, feel free. I'm going to move on. All right, so these are signs of overtraining. So you have really gone above and beyond the training, and it's just too much, to the point where you might have, maybe gotten a strain in your muscle, or a sprain, even worse. There might be a muscle tear, where you may have to go get that looked at. Maybe you might have to get an X-ray. They might not find something in the X-ray, so you might have to get a CT scan or an ultrasound to see if it's something that, it might be deeper. Or you might even go as far as getting an MRI done, so that they can actually see the muscle, deep in the muscle, to see if there are any tears in the back. So you have kind of gone way beyond what normal training would be. So yes, you're going to feel a little motivation. You're going to be super tired, like you have no energy to do anything. You're just not having that same motivation that you once had, because now if you've injured yourself in the back, uh, now there might be where you're going to have to possibly let it heal, maybe 6 to 8 weeks or longer, or you might have to have possible surgery in the back. So that can really set you back. And you might have a hard time sleeping as well. And if you're not getting enough sleep, that could really, cause a problem with your body, healing and repairing and correcting. So believe it or not, that can really cause a problem. And what if, if it's your back and you can't sleep on your back, you're going to have to possibly lay on your side, and that could cause other problems, So it's super important that you do your strength training correctly and avoid any of those problems that we're going to talk about very shortly.
Ready?
I have a question here for you.
Uh-huh.
Let's see. This is from, is somebody talking? Go ahead, I'm sorry.
I was, but go ahead. I'm not sure how this works, so I apologize.
No,
Ask your
you're, question. I'd much rather hear a live voice.
Absolutely.
Go
What is
ahead.
your name?
Well, what was interesting when I saw this come up, I was reading all of these signs, and just recently, ironically, my daughter at 31 was diagnosed with EDS and POTS syndrome. And what's interesting is now, because of this, now everything that's listed here is also signs of having a autoimmune, like a muscular type of imbalance. So, I mean, it just was an awareness that came up that I just wanted to mention, that if this is one of our clients' symptoms, so what are a couple of questions that, I mean, obviously there's other ways of doing physical testing and then asking other questions as far as the history and things. Is there anything else that you could suggest to understand that fine line of what we're dealing with?
Right. Yeah. So absolutely. And when you brought up autoimmune disease of any sort, that, as you know, is inflammation that's going on in your entire body, and it could affect the nerves, the muscle, the joints, and so forth. But it's clean eating is also super important to help reduce that inflammation, because it actually could affect, if you reduce that inflammation as far as the back is concerned, that could also help with relieving whatever, something that might be like impinging on something, like, I don't know, maybe it might be impinging on the nerves because the muscle is so inflamed, or uh, uh, the ability to have enough sleep, that could cause problems too, because you might be turning your body a certain way, and that's causing problems in the back as well. So I would highly consider thinking of other ways to help reduce inflammation, which, most every disease known to man starts with inflammation, and that could affect all of those areas that I was talking about. So consider those things like, what can I do to help relieve the feelings of the pain? Because if you start eating clean, for example, you will start to lose weight, okay, which is actually going to, affect the joints, the discs in the spine, because there's going to be less weight that might be, putting excess force on the muscles, the tendons, the ligaments. So think about the eating aspect of it, getting enough sleep. Uh, by losing that weight, you're going to reduce the amount of weight and pressure and stress on those muscles in the back. But
Yeah,
we can go, yeah. Did you want to
yeah,
add to that?
yeah. Those are excellent, dead on points. I think the thing for us as trainers in helping people with their lifestyle and their fitness needs, their goals, is you can never ask enough questions
Right.
and
Mm-hmm.
dive into those things. You may notice they're a little sluggish, so why
Mm-hmm.
not ask a few questions around that and see about, are you having a hard time sleeping? Is it this? Is it that? How you feel about this? How many hours you working? Next thing you know, you're kind of plowing through some things and coming up with some ideas on what may be the overall conceptual problem that they're not even aware of. And of course, that's what we get paid for. So
Exactly.
kind of keep your head on a swivel and your ears open and start asking some questions and taking notes and document, because it sometimes is a cumulative thing that you figure out over the
Mhm.
course of a few weeks. You don't necessarily put it together all the same day.
Exactly. You want to ask those open-ended questions so that it could lead to a response where they're really going to go in depth on what's really going on. What are the real underlying issues, you
So
know?
if somebody was to say that they actually had EDS, which is not just an autoimmune disorder based or grown by inflammation, but actually a structural genetic inheritance of weakening of the
Hmm.
muscle tone, like you can really hurt somebody if they over fatigue. There's such a subtle balance for everybody. So
Sure.
like, um, if you notice this was happening, I mean, I would suggest that maybe they research it a little bit more. But like if they came to me and they wanted to work on their spinal stability, connective muscle tissue, which is what I'm facing at the moment, I just wondered if you had any suggestions as far as like, um, is it really just doing evaluations, like following up? Okay, how did that bout of exercise go the next day, and how
Hmm.
did you feel that night? How did you feel the next day, and how long did it take you to recover? So
Sure.
if you were like working with that, just wondering, just because I'm going to be dealing with some EDS
Yeah.
people, anytime
Well,
during this, can maybe suggest how to evaluate or keep.
I would, like Jay was saying, document. So have them uh, write a journal on
Yeah,
how they're feeling day by day,
okay,
because that could change.
okay.
And yeah, and by having that journal, you can check on them. I don't know how often you meet up with them, but you can check them on them weekly, take a look at that journal, and then talk about it. How does that make you feel? And then you can talk about what are some things that we can do to improve on that. So you can think of some changes. They could also, you can encourage them to do some research on their own disease, and you can ask them, hey, what did you learn today about what you researched? And so you can have them engaged as well, because this is something that they have to live with. It's a chronic disease that they're going to live with for the rest of their lives. So why not have them educate themselves while you're educating them? But that's one way that you can help them help you, by having that journal, you know. So super important that you're asking them, how are you feeling? How are you eating? How are you sleeping? Super important. And as far as sleeping, find ways for them to help them feel more comfortable, because that sleep is so important as well. You know, if they're not sleeping well, then that will pour into other areas, and they're just feeling miserable. So
Yeah,
you wanna use that.
Yes.
yeah. No, that's great, and thanks for the question. Because I know myself sometimes when I overtrain myself, I have a hard time falling asleep,
Yeah.
and I can go take one single Tylenol just to take the edge off, and I sleep
Hmm.
like a baby. But then I know, because I'm listening to myself, that I'm overtraining with the new routine, so I've got to change it up and back off a little. And those are the
Yep.
things as a trainer you make those adjustments in the
Sure.
field when you're documenting and paying attention. Other
Yeah.
than just they do 3 sets of 12 on everything, you're actually
Right.
getting to know your client and the direction
Mhm.
they're in, and
Yeah.
as you go through, hopefully years of training, you're able to maneuver and adjust, modify because you really know your client.
Hmm.
So,
And
um,
yeah, just remember that I know we're talking about overtraining and strength training on the back, but keep in mind, like I said before, that you want to go ahead and have them not eat past 7 p.m. because after 7 p.m., your body, your physiological functions, your body is now having to repair whatever damage that happened for that day. So it's healing, repairing, correcting. That is its whole purpose while it's sleeping. Now, if someone is eating after 7 p.m., your body is now reverting itself back to breaking down carbs, fats, proteins, and it's not healing your body. So you're kind of sabotaging yourself. Does that make sense?
Oh, yeah. Yeah.
So that is super important. I know it's kind of a little bit off topic, but it's so important to be able to heal from that overtraining or overreaching. I don't know. I hope that helped.
Yep. Thank you.
Yeah,
I have
absolutely.
another question here for you. From Victoria, would that also include progressing too quickly, functional overreaching?
Absolutely. So when you set your goals, you want to make sure that you are going to be doing, sets and reps that, like for example, when you set your repetitions, depending on where you're at. So if you're in the strength phase for your back, you want to set enough repetitions that you're going to go to fatigue, but not to the point of pain. Okay. So there are a couple of methods that you can use. If you however heavy of a weight that you can do on 8 to 12 repetitions, and that's the weight that you're going to use. Or if it's appropriate, you can do a 1 rep max, and you can do 70% or 75% of that 1 rep max, and start with that weight, and you're going to go to fatigue, but once again, not to the point of pain. So, you can set yourself at, 3 sets of repetitions about 4 or 5 days a week. That could be appropriate. Just really depends on what your fitness goals are. I'm just giving you a general population to use, but it's all variable. So hopefully with that type of starting out, you're not going to reach that overtraining or overreaching. But it's when you start going above and beyond, it's okay to do 1 or 2 more repetitions. I'm going to push myself a little bit, but maybe, depending on that fitness level, do you really want to be doing, excuse me, 6 sets? you know? So, just make sure that you keep it appropriate. Uh, if it doesn't feel good, you might be overdoing it. If you start to feel like, oh, I'm starting to feel a little bit of a strain or impingement, you need to stop. So I'm not
Well,
sure
I've
if
got
that.
another.
Go ahead, Jane.
Oh, I'm sorry. Had another one here, and she said it may not be the time. This is from Denise. A question on the frozen shoulder and thoracic spine. I don't know if that's
Mhm.
later in the presentation here or.
Actually, yes, I'm going to cover a little bit of that later on.
Okay,
So
then we'll wait
hold
for that.
on,
Yeah.
hold on to that question. Yes.
Okay.
So I'm going to go ahead and move on to the next slide here. Thank you for those great questions. All right, so muscle strain of the lower back, of course, as we already talked about, is just doing, the same thing over and over again. It's overuse that may lead to, a strain or even worse, a sprain. Strain can be very painful. You could be, it could be so painful that it could bring you to tears, but it might just be a mild strain. But a sprain, this could affect, a deeper muscle tear, or it could affect the ligament, which is really bad, or a tendon, which is the tendon that attaches itself to the muscle. The ligament will be attaching bone to bone. But it's very common. 85% is pretty high. Most people experience some kind of muscle damage. And that's, once again, if you're overtraining, that could definitely happen. This is just an example of a strength exercise. You can see that on the left, he's overarching in the low back. So you want to make sure that you maintain a neutral spine, so keep your back straight on the right side. So does someone have a question? I thought I heard someone. But anyways, these are just some common errors, simple to fix, but just be careful that you don't overarch your back. I know that there are some people that are very flexible, double jointed, I believe, that may be able to go into a farther reach like that. But just watch your clients that, you want to keep that neutral spine, okay? This one here, the Y raise, as you can see on the left side, he's lifting up those shoulders, and you've got too much tension going on there, so you want to just relax those shoulders as you're going through that movement. So go on to another one. All right, so these are just some examples to help strengthen the lower back, and I'm going to show you a picture in just a second. So we've got the seated rows, lat pull downs. These are obviously not all inclusive, but these are really fantastic for strengthening the lower back. And but you want to make sure that you are also strengthening the core area, because if you don't have your strong abdominal wall, for example, this is really going to, if it's a weak abdominal wall, this is really going to put more strain on the lower back when you're going through some of these movements. So it's super important to strengthen that whole core area. All right, so this one here, as you can see, he's going to be doing an extension, a back extension. So he's going to be coming, bending at the hip. He's going to come all the way down into a 90-degree angle. But when he comes all the way back up, you want to make sure that you do not go back farther than that neutral position that you're seeing right here. So you want to keep your head, your spine, your hips, everything is neutral and not going back too far. So I know in the gym you're probably seeing a lot of that. You might see them swinging or swaying too far back, but that is going to lead to injury. So super important that you just come to neutral position. You don't want to go into hyperextension. Okay, so this is perfect form right here. And you want to keep your abs engaged as you're going through this movement. Keep in mind that this movement here is more of an advanced movement. If you're just starting out, maybe if you're on the floor doing like a Superman where you lift your arms up and your legs up, you don't want to go too far up into hyperextension, once again in neutral position if you're doing a Superman, but that could be more of a beginner back extension. So let's move on here. All right, so compound exercises are actually fantastic for the back because they do engage other muscles, those stabilizer muscles, while you're going through that movement. So it's not like a single muscle, like if you were doing, just like a bicep curl, you're just going through one single movement involving just the biceps, for example, you're engaging multiple muscles to get through that movement to contract the back muscle, whether it's the lower back or the upper back. So some great ones are, these are fantastic, specifically for building and strengthening the back muscles. There are so many, but I just wanted to pick these 5 because these are specific for strengthening those back muscles. So core muscles that are involved in stabilizing those major muscle groups of the back are the multifidus, the transverse abdominis, which is a little bit deeper muscle inside of the rectus abdominis. But these muscles, the pelvic floor and the diaphragm, which is more deeper inside, all engage as you're trying to get through those back muscle exercises. So these are super important to strengthen as well. You always want to, the cool thing about abdominal muscles is that you can do them every single day. It's safe, but you're strengthening, helping to strengthen that core area. So once again, we want to make sure that we have a strong back by strengthening the abdominals and all of the muscles that innervate those muscles. Okay, so you want to include all of those muscles. A good one, a good core muscle is like a wall sit, where you're pressed up against the wall and you come down as far as your client is able to go, or ideally come down to a 90-degree angle, and you can time it for as long as you're able to in that position without moving. You know, and you can go ahead and time that and then see your progression over time. So, all right, so anybody, any questions? Anything in the chat?
Nothing in the chat right now. We had
Okay.
that flurry early, but everybody's tuned in.
Great. Okay, so I just wanted to talk a little bit about a proper form and technique, because this is super important. And it doesn't matter which muscle that you are working at, but once again, with the spine, the back, all of the upper and lower muscles, once again, you want to make sure you maintain a neutral spine, neutral cervical spine. If you're doing some back exercises, let's say you're doing like let's say you're doing a bent over row for the low back. So you've got one knee on the bench and one leg on the floor. You want to make sure that the leg that's on the floor is slightly bent. You don't want to lock it out, for example. And you're completely bent over at a 90-degree angle. So you want to engage those abs so that it can help support the back. You're going to have your arm with the dumbbell hanging, and you're going to bring that weight up with the elbow close to the body and come back as far as you can go without having to rotate your trunk. So it's just operating at the shoulder, but you're squeezing your back, your upper shoulder blades to get through that movement. So you're actually coming up and you're squeezing the low back as you're coming up on that movement, making sure that there's no rotation in the spine. But you want to have, you know, if you're at a 90-degree angle, keep those abs tight. Your head is in neutral position. I'm just giving you an example so that you're not like arching the spine or the back, you know. Another one is like a bench press. As you're coming down, you're also engaging the upper back, the traps, the trapezius. So as you're coming down, you know, you want to make sure that your back is flush to the bench, so you don't have that arch in the low back. So that's something that you really want to watch out for. So before you even begin that bench press, you want to go ahead and make sure that their back is flush. That might mean that they're rotating their pelvis and then coming, so they're lifting up their rear, rotating the pelvis and coming back down flush onto the bench. So always make sure that you're watching that back with that bench press. All right, so let's move forward. Also, stretches are super important. You don't really want to give up on those stretch, or you can do those stretches, before your exercises, or after. Ideally, when you do stretches, you want to do them after your workout, but you can do them anytime. But it's really going to benefit you the most for the next exercise bout. So, for example, let's talk about a javelin thrower, an Olympian javelin thrower. Now, the stretches are super beneficial because as they're coming back with that javelin, they're engaging their back muscles. There's trunk rotation, but with the stretches over time, they're going to be able to go through a farther reach on the way back, so that it allows them to propel their arm forward to gain distance on that throw. So they can benefit from doing, stretches in the back, as well as those strength exercises of the back to improve that reach or a greater range of motion. So super important that stretching is probably, 3-4 times a week would be beneficial. You could see gains after just a couple of weeks, 12 days, so it's very beneficial. But there are some stretches that you can engage in. You're seeing here, the downward dog, where you come down and then swing up, going into a cobra position. I'm going to go ahead and show you a couple of a video or two. Let's see if I can pull this up really quick. There's a Jefferson curl that I wanted to show you. Here's the music. And that really is very beneficial for stretching the back, the whole back. That's very beneficial. Let's go ahead and show you another one here. So kneeling T-spine twist. So this really helps stretch out the back and going through that trunk rotation. There are so many stretches that you can do, but this is a really beneficial one that you can engage in. Okay, so let me take a look really quick over here. I've got a video here. I'm going to show you that going through certain movements. I want you to go ahead and take a look at, what they're going through the movement. Are they having neutral spine? Are they swaying their back? So I want you to think about the biomechanical errors, or what they're doing correctly. So let's see if I can make this big. So as you can see here, they're bending at the hip. So not exactly proper lifting techniques. Instead, you can come down, bend down at the hips, and reach for that weight rather than bending completely over. So there's some information there at the bottom. So it's showing you that it's putting excess stress on that erector spinae. So a good way of lifting that is just bending from the knees and picking that up rather than bending over like you're seeing right here. So neutral spine, the back is completely straight. And you're able to lift a heavier load. Okay. So straightening out the back. And that way you can use those back muscles to lift if you're coming down, bending from the knee. Okay. Here he's putting excess stress on those low back muscles. Okay, I think that is enough there. Let's go ahead and go back. Okay, so let's go ahead and go on to the next slide here. All right, so there was a question well, that we were talking about earlier. Let's go back. Can you come back on and ask that question? Are you still there?
Oh,
Hello?
she is.
Oh,
She's.
hold on. Let me turn it up. Sorry.
This movement.
There we go.
So the muscles that span your spine in this neutral alignment
Let me turn.
pick
I
up
apologize.
and basically limit about 70% of anterior shear forces because of the way the muscle fibers run. Now,
apologies. Can you still hear me?
Yes.
Yes. Yes.
Okay, I apologize. A little glitch there. Okay, go ahead.
The question that she had was on the frozen shoulder and thoracic spine.
Mm-hmm. Yes, so with the thoracic spine, you want to make sure that you're doing exercises that are going to strengthen that area, but you want to make sure that you have your back completely straight. Cervical spine also. Can you be a little more specific with the question so I can go ahead and elaborate a little bit more?
I wish I could. Denise had to leave.
Yeah, the video was going on and I couldn't hear part of what was.
Oh, okay.
I apologize.
Yeah, all Denise asked was she had a question on the frozen shoulder and thoracic spine.
Mm-hmm.
That's all she gave me.
Right. So yeah, you've got to just with the shoulders, you just got to be careful that you're not overloading those muscles in the shoulder area because that could lead to impingement. So I would say that, I would say if you're going to strengthen that area, you want to use like a lighter weights, higher repetitions, more of a strength and conditioning area. If the area is already injured, it's a good idea that you do some strength and conditioning. If you've already gone through, like if there was a surgery and you've done your physical therapy or rehabilitation, you just want to take it easy on that area.
Okay. Simple and sweet. That's good.
Mm-hmm. Any other questions?
None on the board here unless somebody has one.
Hi, this is Phyllis. Yes, I do have a question. I have a client that I work with, an older client who has Parkinson's and also experiences lower back pain and have difficulty, of course, getting down onto the floor, which many exercises will help that on the floor in supine or prone position. However, are there exercises that I can lead this client in to help with that lower back pain, seated or possibly standing?
Right, yeah. So yeah, that's exactly what you could do is have her sit in a chair and stand up and sit down, help her, strengthen that muscle because is she like used to being sitting for the most part? Because she's just having trouble getting up, right? So that sitting down and standing up is a really good movement. Just start, nice and easy. And as she gets stronger, she could add a dumbbell and sit and stand as well. I probably would not have her doing exercises or stretches like on a medicine ball because that could increase the risk of injury. So that would be a good idea to do that, because it's kind of squirrely moving around, but and then once she gets a little bit stronger sitting up and down in that chair, she might be strong enough to get down onto the floor, but I'm not sure if she would be able to do like a wall sit, for example, because it's super important to build the core muscles around the back. So Yeah, absolutely. I might try like a wall sit, for example. Obviously, she's not going to be able to come down as much, but a little bit is better than nothing, right? So even if she's just is able to go up against the wall and just come down just a tiny little bit and just, time that, and then she probably wouldn't be able to hold out for too long. But, continue doing that because that could really, it's something that's easy that she can do and she can actually improve on that over time.
Okay, thank you so much for that, because I guess I am on the right track because we have been doing the sitting and rising, like a sit to stand. And we're only at 3 right now, but at least we're doing 3.
Right. Yes.
Could
Thank you.
I interject something here?
Please.
Absolutely.
I work with an older demographics, and it was really cost effective to buy a portable massage table, but a wide one. And I actually set it at their knee level so that they can do prone and lay down. And, so it has been helpful for certain clients to be able to offer them as well as standing and sitting. But to get in, they look, because they hardly ever, down into that prone position anymore, which is what the body is craving. So I just started bringing the table to go to their level that was comfortable for them to get off and on.
Absolutely. Yoga is also very beneficial as well. Obviously, there's some movements that are a little too much, but I would definitely do a little bit of research on yoga movements because I have seen where there was a really elderly lady that was like she was completely leaned over forward, and over time, I think it took something like a year of doing some yoga movements that she finally was in an upright position. So there are some really great games that you can benefit from those yoga movements. So I would definitely explore that.
Okay,
Hey,
thank you.
yeah, that is awesome.
Yes.
Did somebody else have something there?
No, I just wanted to thank her also for the suggestion regarding the massage table. That was something I was considering, but I just wasn't sure in that regard. But understanding that there is a wide version, that makes all the difference. Thank you.
A little heavier sometimes, but it's worth it.
Okay. Thank you, everybody. I love the interaction. That's why we give the CEC for you attending. It's and doing the quiz. It's important as colleagues. I will say that we're running very close to the end, and I've had a couple people ask if we can cover more of these questions at the end because they're short on time, I guess, with having to get back into work wherever they're at. So I don't know how many slides left we have.
This is the last one right here.
Oh, is this the last one?
Well, the poll questions and then just my information. Yeah.
Oh, great. Okay, and then I can ask the rest of these questions that popped up on the board, or if anybody else wants to ask them, post the hour. That's great. Okay, thank you.
Yes, of course. All right, so a couple of poll questions here based on what you've learned today. Can you identify common biomechanical errors with different weightlifting movements? So can anyone feel free to answer this one?
Based on what you learned today, can you
So what is a movement or a strength exercise, and what could you do to correct a biomechanical?
I've got two that popped in here for Marion and Brittany for hyperextension and Patricia for neutral spine.
Right, neutral spine, avoid hyperextension. Perfect. Good. All right, can you name one upper and one lower back strength exercise and describe proper form and technique? Oh, that's a lengthy one there, to prevent their respective associated common errors. So we can just do one. Is there one movement that anyone can describe, either the upper or the lower?
Patricia put seated row down.
Absolutely. Seated row, perfect. And so what is something that you can do to make sure that you are doing proper form and avoiding common errors or biomechanical error with that seated row?
You can keep the shoulders lowered, so not elevated, and then keep the elbows closer to the rib cage.
Exactly. Yes, yes. You can have your chest up also, okay? Because remember, we're slouched over, so chest up, and that way you're contributing to that neutral spine also. And of course, in that seated row, you're gonna kind of lean back just a little bit, and so that you can go through that full range of motion. Good.
Yeah, yeah, and Melanie put down keeping neck and spine in neutral position.
Perfect.
Bridget put engage core.
Absolutely. With
Yeah.
every exercise.
Yeah, yeah. Okay. And see, Joy threw in there TRX rows, keep hips and abs activated, shoulder blades down through the whole movement, head neutral. And I love neutral. So many trainers overlook that, and that's what they get paid to watch for, is neutral alignment.
Exactly. So yeah, I would encourage everyone to, like I said before, the back exercises, you want to make sure that you do correct that with your clients, always looking out for what errors that might pop up. And think about those things into your activities of daily living as well. So have them, your clients, well, what are some of the things that you do on a regular basis, like reaching for something in the cabinet or picking something up? Teach them about those correct biomechanics so that it can alleviate or reduce the risk of injury. You don't want to contribute to the already existing injury, for example. So there's things you can do to alleviate that.
Beautiful. Yep. We've got some others chiming in. Charles, thanks. Back neutral, no kyphotic movements.
Exactly, yes.
Michelle put in here, it is important to monitor form, neutral spine, shoulders down, and pelvis tucked. So that's all great stuff, guys.
Yes, absolutely. I think one of the biggest things that contribute to back problems that we do on a regular basis, it seems like all day long, is texting on your phone, or looking at whatever on your phone. And, there's that, it's something that's called text next or text neck. And that's a thing. So it's putting a lot of stress and tension on that neck. So if you think about it, when you're texting, you're like slouched over texting, right? So bring the shoulders back, sit up straight in neutral spine, put the phone down, and if you need to, text, put it down, because that's also adds weight to your hands, which is also contributing to the shoulders, the back part. And so what happens is that if you're slouched over or your head is protruding forward, you're adding more weight. Our head weighs about roughly 8 to 10 pounds. So if you go forward just an inch, that's really adding a lot more tension to the whole upper back area. So be mindful of that, and think of ways where you can help alleviate that as well.
Hey, I tell you, that's perfect. That's exactly what we love to share here. And we're going to stick around a little bit, a few more minutes, and answer some of these other questions. I know some of you have to go, and all the essentials are there for your quiz, so don't worry about that. But anybody wants to stick around and still keep engaging, going through this, hey, that's what this is here for. Let's see, what do we got here? A lot of thank yous. As some
You're welcome. It was my pleasure.
I have just a question. I work with elderly clients as well. And I have several that cannot get on the floor, and I don't, because they could never get up from the floor. I also talk to them about if they should fall, the proper way to try to get up, get to the places and things. We do practice that if I can get them down. But
Right.
I also use, because of trying to work the core, is the reverse crunch on the chair and just coming down and coming back up because they can't go on the floor. So I have them
Right.
come back, but I really make sure they have they're not going too far back and they're not hurting their back or their core. Is
Right.
that sound like it should, that's the way to go with them? I'm trying to get the core activated.
Absolutely. And I would encourage, I know they're elderly, but I would definitely encourage them to use very light weights, even if they're starting out with water bottles or, maybe 1 or 2 pound weights, and do a little bit of lifting. Okay, so they can engage in like bicep curls while they're sitting. They can do upright rows for the upper back. They don't have to bend over to do the seated rows. But I would say high repetition, low weight. I would say maybe 3 or 4 days a week, because this is really going to improve the strength, not only in their back, but their whole body. Because if they do fall, what's going to happen is that maybe they might break their wrist or strain it or sprain it, but the doctor is going to be so amazed at how quickly they actually heal from that. That actually happened to my grandmother, who was 76 years old. She tripped on a step and fell back and broke her wrist, and she healed nicely from that.
I do incorporate light weights with, and also I do bands as well.
Perfect. Yes.
So
Yeah.
Mhm.
No, go ahead. I'm sorry.
No, I just wanted to make sure that I'm on the, I'm continuing on the right track with my ladies.
Yes, absolutely.
I have something to add to that if there's time, but
Yes. Well, we're past time, but we're going to keep going. So that's what this is all about. So feel free.
Can I mention one more thing to the lady that was just on? If it's just by herself, maybe you and her can grab like a very light medicine ball or a ball or something like that, and put yourselves back to back, and take that ball and rotate to the right. Rotate to grab that ball. Yeah, both ways. Add some fun into it.
Right.
Yeah.
Do some.
I try to do that. I do have some balls. The problem is I have a group of ladies live, and then I also have them on the screen. So we have to try to find ways to work with all of them. So it's been a challenge, but
I bet, yeah.
stick it with me. So that's good.
Okay, yeah, absolutely. Okay, so there was one more question. I apologize.
No, I was just going to suggest that when she's doing the seated half roll downs, to incorporate that small ball you just talked about, but in their adductor. So as they're eating, it helps them with that pelvic floor lock so that it's safe for them to go into a little bit of flexion.
Absolutely, yes.
Those muscles. Yeah.
I had some questions as well.
Sure.
If everyone else is, I kind of have two. I also work with an older population, as I think many of us do. And the two concerns that I'm seeing, one, arthritis and osteoporosis are a big deal, or at least a common thing. And I also have a client that has spinal stenosis, so a narrowing of the spinal column. And so I was wondering if there were any special considerations for those two populations.
Yeah. So first of all, people over the age of 50 tend to lose up to 50% bone mineral density. So unfortunately, that could lead, they're susceptible to injury pretty easily. So it's super important to not only do strength exercises to strengthen the back, but also, it's going to help strengthening the bone mineral density of the bones as well. So, you know, maybe going upstairs, up and down stairs, or walking up a hill, anything that you can do to help strengthen the bone and along with the muscle as well. So it's a good idea to incorporate some exercises to strengthen those bones too, because like I said, they're going to be very susceptible to injury, and you want those bones to be very strong. So just make sure that you're giving them a appropriate weight, heavy enough for them to go through whatever, you know, repetitions that you're going to go through to fatigue, but not to the point of pain. So
Good, good. I have one here from you, from Patricia. It said your thoughts on flat back versus the natural curve.
Right. So for me, for example, I have an anterior pelvic tilt. So I've got like an over exaggerated, you know, arch in my low back. And like if I was on the bench press, for example, yeah, you see those people lifting like 350 pounds, and they've got their back really arched, and they're, you know, they're trying to bounce it off their chest as they're going through a bench press, holding their breath, you know. It's really, you know, just asking for disaster, you know. So like I would lift my rear, rotate that pelvis, and make sure that it's flush to the bench. So just super important that you have that back straight. Really, you don't ever want to be arching that back, going through some of those strength exercises, because that could lead to further injury, you know, if there's existing injury, or, you know, you don't want to be tearing muscle fibers, or even worse, you know, tendons or ligaments. So at all, you know, at all costs, try to make sure that that spine is neutral.
Yeah, and I guess I could tag it on this before this next question, just say that everything we're going through here, I think Letty's made it pretty clear, and I think you guys know enough as pros, but we're really educating our clients in these areas for the home stuff, so they don't end up doing silly things, neutral alignment, understanding the concepts of it at all areas of the body, neck, whatever, so that when they get home and they do different things, they go to pick up something or whatever, reach on the shelf, that they're not aggravating something that we're working with and helping them with in the facility, and then they go home and not paying attention to neutral alignment or other areas of their body. Tweak it, right? And then we start all over again. So I have one.
Go ahead.
I'm sorry.
I have time for one more question. I'm sorry.
One more question. That's okay. And we can always talk about some of this later, gang, as far as maybe setting up more time. Right now we have from Janice, with the kneeling thoracic twist, what is the difference or benefit of having hips closer to heels versus being in a quadruple position with hips over knees?
Right, so you're just going into, by bringing your legs closer, your knees closer, you're going through a deeper stretch, okay? So just remember that you're on all fours, and so that might not be ideal for, you know, certain populations. But like I said, going through a deeper stretch, and I think I explained that. What's that? Did I?
No.
Oh,
Go
okay.
ahead.
Yeah, so yes, definitely, it's a very beneficial stretch. Going through that, just, you know, bring your arm all the way through as you're twisting your back, all as far as you can go, and then of course you're going to do the opposite side. But you know, there's other stretches that you can go through to get that same type of stretch. You know, like you can go through yoga, the child's pose, and that can give you a great stretch as well. But the thing is with that one is that, you know, you've got your knees bent at a much, you know, a tighter angle. So that could possibly affect the knees. So you gotta be careful with that one.
That is great, Letty. I appreciate the extra time, and we can talk about maybe having a fun Q&A on this kind of stuff in the very near future. And you were brilliant as usual, and I even had a couple students in here from your Mount San Jacinto class from 2015 that wanted to say hi. So anybody, please feel free to, I took some last minute pictures of the question board, and we'll look to do something here in the near future where we can do maybe a Q&A with a panel of people and have some fun exchanges for it. So anyway, everybody have a magnificent evening on the East Coast. On the West Coast, you're just getting started. Have a great night. Thanks, Letty.
You're welcome.
Thank you very much.
Hi, Janet.
Thank you.
Thank you.
Thank you.
Bye, guys.
Bye, everybody.
Bye,
Can you
everybody.
put your contact information up?
Yes.
Oh, yeah, on the last page. I'm sorry, it's right there. If you want to take a screenshot or a picture of that.
It'll be in your recording, too. It'll be at the very end. Because I'm still recording. I'm going to send the whole thing because these were great questions. So.
Perfect.
Awesome.
Thank you.
Thank you.
All right, guys, have a good night.
Bye.
Bye-bye.
Night.